Dissociative disorders. Dissociative disorders are mental illnesses that involve disruptions or breakdowns of memory, awareness, identity, and/or perception. Dissociation is a coping mechanism that a person uses to disconnect from a stressful or traumatic situation, or to separate traumatic memories from normal awareness. Dissociation can serve as a defense mechanism against the physical and emotional pain of a traumatic or stressful experience. By dissociating painful memories from everyday thought processes, a person can use dissociation to maintain a relatively healthy level of functioning, as though the trauma had not occurred. Some examples of dissociative disorders are dissociative amnesia. Victim has severe difficulty in remembering one's information about themselves. Dissociative fugue. Victim, because of severe stress, has a hard time remembering their identity and takes on another. Dissociative identity disorder. Victim has many identities that control their actions and behaviors at different time periods. Dissociative identity disorder. Dissociative identity disorder, also known as multiple personality disorder, is a severe condition in which two or more distinct identities or personality states are present and alternately take control of an individual. When in control, each alter may be experienced as if it has a distinct history, self-image, and identity. The alter's characteristics, including name, reported age, and gender, vocabulary, general knowledge, and predominant mood, contrast with those of the primary identity. The person with dissociative identity disorder may or may not be aware of the other personality states and might not have memories of the times when another alter is dominant. Stress or a reminder of the trauma can act as a trigger to bring about a switch of alters. Statistics show that dissociative identity disorder occurs in 1/100th to 1% of the general population. Causes. It is generally accepted that dissociative identity disorder results from extreme and repeated trauma that occurs during important periods of development during childhood. The trauma often involves severe emotional, physical, or sexual abuse, but also might be linked to a natural disaster or war. In order to survive extreme stress, the person separates the thoughts, feelings, and memories associated with traumatic experiences from their usual level of conscious awareness. Individuals with dissociative identity disorder may also have post-traumatic symptoms or post-traumatic stress disorder. Several studies suggest that dissociative identity disorder is more common among close biological relatives of people who also have the disorder than in general population. As this once rarely reported disorder has grown more common, the diagnosis of dissociative identity disorder appeared to be more common in women than in men. This might be due to the higher rate of sexual abuse in females. Symptoms. Symptoms of dissociative identity disorder are similar to those of several other physical and mental disorders, such as substance abuse, seizure disorder, and post-traumatic stress disorder. A person with dissociative identity disorder might repeatedly meet people who seem to know him or her, but whom he or she does not recognize. The person also might find items that he or she does not remember buying. Other symptoms include the following: changing levels of functioning from highly effective to nearly disabled, severe headaches or pain in other parts of the body, depersonalization, derealization, depression or mood swings, unexplained changes in eating and sleeping patterns. Treatment. The primary treatment for dissociative identity disorder is long-term psychotherapy with the goal of deconstructing the different personalities and uniting them into one. Methods include psychotherapy. This kind of therapy is for mental and emotional disorders. Uses psychological techniques designed to encourage communication of conflicts and insight into problems. Cognitive therapy. This type of therapy focuses on changing dysfunctional thinking patterns. Medication. There is no medication to treat the dissociative disorders themselves. However, a person with a dissociative disorder who also suffers from depression or anxiety might benefit from treatment with a medication such as antidepressant or anti-anxiety medicine. Treatment also aims to help the person safely express and process painful memories, develop new coping and life skills, restore functioning, and improve relationships. The best treatment approach depends on the individual and the severity of his or her symptoms. Prevention. Although it may not be possible to prevent dissociative identity disorder, it might be helpful to begin treatment in people as soon as they begin to have symptoms. In addition, an immediate intervention following a traumatic event can help reduce the risk of a person developing dissociative disorders.